Well, viewers, COVID-19 has once again made a resurgence. Believe it or not, 5 years since we started talking about COVID, there has been lockdowns. Well, we are talking about it all over again. Unfortunately, cases have spiked in Asia and so in India as well. 164 new cases have been reported since 12th of May, with Kerala reporting the highest at 69. And Singapore, Hong Kong are experiencing fresh waves, while in India, symptoms remain mild. There's no cause for alarm. But what is it that we should be bracing ourselves for? What has been the learnings from COVID that we need to keep in mind and ensure that going forward, in terms of our public health responses, India is better prepared? To talk on that, I want to quickly now get in Dr. Arjun Dang, who is the CEO of Dr. Dang's lab, to understand from him what is it that we should be looking at. Dr. Dang, explain to us that when you talk about this COVID spike that has come in parts of Asia, including in India, what is it that we should be looking at and be prepared for?
Thank you, Gaurie. Unfortunately, it does feel like deja vu, like you said 5 years back. But the only difference I would say is that we are a lot more wiser today. Today, we are, of course, better prepared to handle the situation in case it escalates to that extent. And the cases also that we've seen rise in Southeast Asia have been mostly attributed to JN1, that is a sub-lineage of the Omicron variant of the COVID-19 virus. That is also known as Pirola, and it is the BA2.86 variant. Now, what we must be careful of is that the virus has mutated. It has certain spike proteins using which it mutates and gets stronger and also more transmissible. Luckily and fortunately, the couple of hundred cases that we have in India right now have not been severe and have been easily managed. But of course, moving forward, I think it is time to be extremely watchful and vigilant. I think from a public perspective, what all of us practiced last time was precision public health measures, and we have to do the absolute same. From a central or a government or a state government perspective, I think preparedness is key. I think the recent meeting also that the government had, there was a lot of talk about being prepared, not only from a healthcare infrastructure perspective, but also more importantly from a surveillance perspective, so that we can know exactly what is happening with our ear very close to the ground and take actions at the right time, and obviously have guidelines to guide the broad public as well.
Okay, so just an update. Mumbai's 2 COVID-linked deaths have been attributed to comorbidities, not the virus itself. So, Dr. Dang, we're going to speak again. Hopefully, we will only continue to speak about mild symptoms and India's preparedness, not anything untoward. But with COVID, unfortunately, it brings horrific memories.